Hi, I'm Dr. Bill Kim, BCHD's Chief Medical Advisor. Beach Cities Health District strives to promote the health and well-being of all members of our community. Substance use, especially among youth, is a concern in the beach cities of Hermosa Beach, Manhattan Beach, and Redondo Beach. Based on medical evidence, Beach Cities Health District recommends that youth and young adults under the age of 21 abstain from using substances such as alcohol, cannabis, vaping, and unprescribed prescription drugs in order to protect their developing brains and optimize healthy brain development. According to the 2021 BCHD Community Health Survey, substance use in the beach cities is higher than county and state levels for both adults and youth. Yet more than 70% of the respondents believe that substance use in the beach cities is about the same as other communities in Los Angeles. Data shows that accessibility and social norms of acceptability play a large role in youth use and the onset of when youth begin using cannabis. Marijuana use among beach cities youth has declined since 2018. However, with the potential for the introduction of retail marijuana in the community, this decline in use is at risk. Here are some of the data. According to the 2022 California Healthy Kids Survey, the percentage of beach cities' 11th graders who reported using marijuana increased to 16%. Since California legalized the recreational use of marijuana for individuals over the age of 21 in 2016, the perceived risk and harm of both occasional and daily use of marijuana by beach cities' youth decreased across all 3 grades surveyed in the California Healthy Kids Survey. Effective education, partnerships, and policy adoption can limit the harmful effects of cannabis on our community.
Increasing and yearly, increasing worse during the pandemic years, and reaching the highest levels we really have seen probably ever. So it's a continual increase in use and in problems related to the use.
Here is pretty prevalent. Most of our teens, if they haven't used or tried some formulation of marijuana, have at least been exposed to it. They know someone that has.
Vaping, the pens, the dabbing, the edibles, in addition to old smoking, but even that's sort of way down the list for the most part.
They're still using flower, right? So cannabis buds are still being used, but the huge push that we're seeing a lot of is with concentrates, right? So gummies, brownies. I don't know, how much you keep up with the news, but I mean, I've seen some really crazy formulations. Lollipops, inhalers. There's this very, very permissive attitude towards it, where a lot of kids are talking about it as though it's a safer alternative to alcohol, and it's also a lot easier to get a hold of than alcohol.
Primarily, I'd say social media is a huge one. It's frightening as to how attractive these things. You rarely see a video with somebody getting sick, somebody feeling psychotic, somebody being dragged to the emergency room in an ambulance.
Another really big piece of it is addressing underlying mental health struggles. I think that students oftentimes they're trying to find an identity. They're trying to use it as a way to fit in. There is certainly a reflection of the parental kind of perception that it's just weed, it's just cannabis, it's not that harmful, and not connecting the dots or understanding that this is a very different substance than what a lot of these parents used.
Minimization. Teens feel, well, if it's legal, there probably is nothing wrong with it, and that drives a whole other road to desire to use it.
I would just say that families have conversations about this stuff. Educate yourselves, right? Understand that the cannabis being used today in these concentrated forms is very, very different from the cannabis that you may have experimented with. And it's important to understand that the consequences for a young person who still has a developing brain using that is very, very different than the consequences of a healthy adult whose brain is fully developed.
Talk to your kids, that's always the antidote. I didn't make it up, but I use the expression, talk so your children will listen, and listen so your children will talk.